Misinformation that everybody's been hearing online or social media, but I think it's important to listen to the government's advice and get the vaccine.
I think the hesitancy for people to come forward in certain communities has been a real worry for us, and it's been at the forefront of our minds in terms of the 5 practices working in such a diverse community of Chapeltown in Leeds. And we've made it a top priority to make sure that we can really get the messages on the ground. And I think there's a few key things that we need to think about. I think that the messenger is just as important as the message. So we all know that if you have trusted people from the community, getting those messages out, so whether that's community leaders, whether that's third sector, whether that's our faith leaders who have been amazing throughout this whole pandemic, giving people hope and praying for people and supporting people, often forgotten. If they come forward and support us with the message, I think we'll be more successful with that message. And that's really, really important, is that the messenger is just as important as the message. I think the other thing to say is that if a certain person says, a patient says, I don't want the vaccine, I don't think that we should write them off. I think what we should say is that they've said not now, and we need to re-engage those people. And I think we shouldn't vilify communities and say, yeah, they're saying no. Actually, what they're saying is not now, and I can understand that. Public confidence is at an all-time low, and trust needs to be built. So I think it's complex, but I think that we're getting there, and there's lots of things that we are putting in place, from linking with people of the community to get the right messages out, in terms of looking at our websites and the information that we're getting out. And also, don't forget the volunteers. They can see on the ground what's happening, and they go out to their communities and say, this is what's happening on the ground. So people say, well, nobody wants the vaccine. Well, somebody does, because we did 800 yesterday.